Recognized for her 5 minutes.
Thank you, Mr. Chair, and I'd like to just say I associate myself with the impassioned Christian grace and words expressed by my colleague, Representative Ocasio-Cortez, a moment ago. Last year, I introduced the Ending Push Out Act to reverse the criminalization and marginalization of Black and brown LGBTQ+ youth and cisgender girls in our schools. LGBTQ students, especially gender nonconforming students, are up to 3 times more likely to experience harsh disciplinary treatment, even though gay and transgender youth are often the victims rather than the aggressors in school conflicts. The Ending Push-Out Act, which I introduced, would invest in the Department of Education's Office of Civil Rights, the sole office charged with holding schools accountable if discriminating against students. Meanwhile, under the failed leadership of Education Secretary Betsy DeVos, the OCR has abdicated this critically important responsibility. In February 2018, Secretary DeVos announced the OCR will no longer investigate any transgender discrimination claims in schools, and according to the Center for American Progress, LGBTQ-related complaints were 9 times less likely to be investigated under this administration than under the Obama administration. Ms. Warbelow, what are some of the consequences of the Trump administration's decisions not to protect one of our most vulnerable student populations?
Not only will these students experience discrimination in schools that goes unchecked, teachers feel disempowered to address the discrimination they see in front of them, and sometimes teachers and administrators are actually engaging in the discrimination themselves. And when students face discrimination in education, they are more likely to end up a part of the homeless population that we were discussing previously. They're more likely to end up in that cycle of poverty and to need the services that the government so critically provides. And yet there too, they experience discrimination because we have not closed the gaps. We have not passed laws like the Equality Act that are absolutely fundamental to ensuring equality for all Americans in this country.
And the data does support the fact that elevated rates of PTSD among our LGBTQ children, trauma linked to bullying, familial and religious rejection, higher rates of homelessness, all lead to emotional distress, self-harm, and suicidal behavior. Ms. Warbelow, in what ways has this administration undermined the ability for schools to respond to trauma in LGBTQ students?
This administration has discouraged students from seeking the appropriate care and support of school districts. It's allowed school districts to turn a blind eye and has encouraged school districts by rescinding critical questions on data collection instruments from understanding what the actual needs of the LGBTQ population are.
A moment ago, Representative Ocasio-Cortez brought into the room the tragic loss of life of a trans woman in her district, and I want to bring into the space the loss of life of a transgender man in my district who was denied health care. We know that discrimination against transgender individuals is pervasive in health care. In my home state of Massachusetts, Alexander Pangborn, a hospice nurse and transgender man, was denied medically necessary gender-affirming health care by his employer. He works 40 hours a week for this company, delivering care to people in their twilight years, and yet was denied medically necessary care in return. This administration is reversing protections based on sexual orientation and gender identity in the Department of Health and Human Services and under the ACA. This means that people denied care who cannot afford a lawyer are denied justice. Mr. Minton, thank you for sharing your personal experience. What threat is posed when transgender individuals are denied gender-affirming care and lack of a pathway to justice?
I mean, the threat that is posed is anywhere from the lasting scars that are in my life and in my heart to death.
Great. This administration continues to abandon our LGBTQ+ neighbors by removing protections and barricading justice for the most vulnerable while funneling taxpayer dollars into discriminatory organizations. They think that by denying shelter and life-saving medical care, by starving, expelling, and incarcerating LGBTQI people, they will disappear. They will just simply disappear. And this is abuse, plain and simple, and we just can't stand for it. Last August, our committee joined in a multi-committee bicameral investigation to understand how a rule greenlighting this kind of anti-LGBT discrimination in healthcare was developed, as well as who was behind it. Ms. Warbelow, could you explain how this refusal rule would further entrench marginalization of the LGBTQ community?
By taking what is a statutory requirement and expanding it out of control, the administration is encouraging discrimination in a wide variety of healthcare situations, including access to PrEP, treatment for HIV/AIDS, fertility care treatment and access. And we know that hospitals are turning away trans patients not only for transition-related care, but also for things like having a broken ankle. We've heard of a home nurse that refused to bathe a gay man because she believed that he was a sinner. She was his sole caretaker in a medical context. I can only imagine what people are doing to their trans patients.
Thank you. The gentlelady's time has expired.